In this video, I will show repair of a through-and-through small bowel trocar entry injury with a robotic platform. The case involved a 60-year-old female referred for a pelvic mass. MRI showed a 5 by 4 by 4.4 centimeter mass between the bladder and the rectum. Her symptoms included pelvic pain without postmenopausal bleeding. Patient had a past medical history of arthritis, a robotic supracervical hysterectomy, cesarean section, and patient had a BMI of 29. Let me preface the video by saying that my second-year resident on the gynecological service gained access to the peritoneal cavity through Palmer's point in the left upper quadrant. This is my usual access to the peritoneum via direct optical trocar entry. Instead of mild rotational force, downward force was applied. This resulted in a through-and-through proximal ilium trocar injury recognized immediately on entry. Once the trocar injury was recognized and evaluated, the decision was made to close primarily instead of a laparotomy. A 2-layer closure was used. At this point, 500 milligrams of Flagyl IV were given. The first layer used was with 3/0 absorbable vicryl suture in an interrupted fashion. For my second layer, I used 3/0 permanent silk suture on an SH needle in a Lambert style fashion. Closure of the defects was performed transversely to ensure that the lumen of the small bowel was not narrowed. The posterior trocar injury was identified and closed in a similar fashion. The repair was evaluated. The area was irrigated and suctioned. The rest of the small bowel at the area of entry was evaluated. There were no other injuries, and the area was found to be hemostatic. In conclusion, the procedure performed was a robotic-assisted tracheolectomy, and the small bowel was repaired primarily without the need for laparotomy. Patient remained afebrile with stable vital signs. Her white count was 9K on post-op day 2. She was discharged on full liquids, and the final pathology returned leiomyoma of the cervical stump. Thank you for your attention.